Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the lower limb lectures, I'm going to discuss in this presentation a summary for the vessels and nerves of the lower limb. I'm Dr. Dalia Saleh, professor and the head of anatomy department at Mansoura University, Egypt. In this presentation, I'm going to cover the following objectives. First, I'm going to talk about the arteries of the lower limb. They include the femoral artery, the gluteal arteries. Then I'm going to talk about the veins. We have the deep veins of the lower limb and the superficial veins. And then I'll talk about the nerves of the lower limb. And I'm going to focus on the following: the femoral nerve, the obturator nerve, the sciatic nerve, and the nerves at the gluteal region. The arterial supply of the lower limb comes from the abdominal aorta, where it divides into two common iliac arteries, and each common iliac artery will divide into internal iliac artery, which remains in the pelvis and gives branches that supplies structures inside the pelvis and perineum. However, it gives three branches that will supply structures of the lower limb. The first branch is the superior gluteal artery, which leaves the pelvis through the greater sciatic foramen above the piriformis muscle, and it supplies structures of the gluteal region. While below the piriformis, we have the inferior gluteal artery and the obturator artery. These two arteries will also leave the gluteal region and descend downward to the thigh. The inferior gluteal artery will share in the arterial anastomosis at the back of the thigh, while the obturator artery will descend on the medial aspect of the thigh and supply the muscles there. The other division of the common iliac artery is the external iliac artery, and it will be the main source of arterial supply for the lower limb. The external iliac artery passes below or beneath the inguinal ligaments and changes its name into the femoral artery, which descends in the thigh and then reaches the back of the knee joint and changes its name into the popliteal. At the lower border of the popliteus muscle will divide into two tibial arteries. The anterior tibial artery is seen at the front or the anterior aspect of the leg, and the other terminal branch is the posterior tibial artery seen at the back of the leg. The anterior tibial artery passes in front of the ankle joint and form the dorsalis pedis artery to supply the dorsum of the foot, while the posterior tibial artery passes behind the medial side of the ankle joint and gives the two plantar arteries, the medial plantar and the lateral plantar arteries, to supply the sole of the foot. If we talk in details about the femoral artery, it begins as a continuation of the external iliac artery distal to the inguinal ligament, then descends in the femoral triangle, and then descends through the adductor canal, which lies opposite the middle part of the thigh, then leaves the thigh through the adductor hiatus to reach to the back of the knee joint and becomes the popliteal artery. The femoral artery has many branches. Three superficial inguinal arteries. We have the superficial epigastric, the superficial circumflex iliac, and the superficial external pudendal. Then we have the deep external pudendal artery, and the main branch is the profunda femoris artery or the deep femoral artery. The profunda femoris artery gives the medial circumflex, which is the main arterial supply for the hip joint and the head of the femur. Also, it gives the lateral femoral circumflex artery. Both the medial circumflex and the lateral circumflex femoral arteries share in the anastomosis around the femur. Then, the profunda femoris artery gives perforating branches that pierces the adductor muscle to reach the back of the thigh and gives the main arterial supply to the hamstring muscles. And the profunda femoris itself ends as the fourth perforating branch, and they all share in the anastomosis at the back of the thigh. The femoral artery, while passing through the adductor canal, it gives the descending genicular artery to share in the anastomosis around the knee joints. The popliteal artery begins as a continuation of the femoral artery at the level of the adductor hiatus. It runs through the popliteal fossa close to the knee joint and terminates at the lower border of the popliteus muscle by dividing into anterior and posterior tibial arteries. It gives 5 genicular branches to the knee joint. We have here the upper lateral genicular, the upper medial genicular, the lower medial genicular, the lower lateral genicular, and the middle genicular arteries. The anterior tibial artery, it begins as one of the two terminal divisions of the popliteal artery at the lower border of popliteus muscle. It enters the anterior compartment through a hiatus or a foramen in the interosseous membrane and descends in the anterior compartment between the extensor muscles. It terminates by passing in front of the ankle joint between the two malleoli to become the dorsalis pedis artery. It gives muscular branches and also recurrent tibial branches and medial and lateral anterior malleolar branches. While the posterior tibial artery begins as one of the two terminal divisions of the popliteal artery at the lower border of the popliteus muscle, it descends in the posterior compartment on the medial side close to the tibia and terminates at the medial side of the foot to become the medial and lateral plantar arteries. During its course, it gives many branches. The most important is the peroneal artery, which lies on the lateral side. It gives a nutrient branch to the fibula and also lateral malleolar branches, while the posterior tibial artery itself, it gives nutrient branch to the tibia, muscular branches to the posterior compartment muscles, and also the medial malleolar branch. For the arteries of the sole, we have the medial plantar artery, which is the smaller of the two terminal branches of the posterior tibial artery. It supplies the medial side of the foot and the big toe. While the lateral plantar artery, of course, it is the larger of the two terminal branches of the posterior tibial artery. It curves medially at the base of the fifth metatarsal bone to form the plantar arch. The plantar arch joins the dorsalis pedis artery in the first intermetatarsal space. It gives plantar metatarsal and plantar digital branches. For the veins of the lower limb, we have two sets of veins. We have the superficial system, which is formed of long saphenous and short saphenous veins. And we have the deep system of veins. They start with vena comitans that accompany the tibial arteries. They then unite to form the popliteal vein, which passes through the adductor hiatus opening to change its name into femoral vein, and then the femoral vein passes beneath the inguinal ligament to form the external iliac vein. The superficial system is characterized by presence of valves, and the direction of circulation will be from the superficial to the deep veins. The long saphenous vein starts at the medial side of the dorsal venous arch of the foot. It then ascends in front of the medial malleolus, then posterior to the medial side of the knee, then ascends upward in the anterior side of the upper part of the thigh, and finally pierces the deep fascia to terminate into the femoral vein. The short saphenous or the small saphenous vein is formed from the lateral side of the dorsal venous arch of the foot. It ascends behind the lateral malleolus, then upwards in the calf, and along its course it drains the lateral side of the foot, the ankle, and the back of the leg. It pierces the deep fascia to terminate at the popliteal vein. The nerves of the lower limb come from two sources, the lumbar plexus and the sacral plexus. The lumbar plexus gives many branches. We only focus on 4 of them regarding the nerves of the lower limb. Of course, we have the femoral nerve, the obturator nerve, and 2 cutaneous nerves, the lateral cutaneous nerve of the thigh, and the genitofemoral nerve. The other source of nerves to the lower limb is the sacral plexus, which also gives 4 branches that concern us in the lower limb. We have, of course, the largest nerve in the body, which is the sciatic nerve, the superior gluteal nerve that supplies the tensor fasciae lata and gluteus medius and minimus, inferior gluteal nerve, which supplies the gluteus maximus muscle, and the posterior cutaneous nerve of the thigh, which supplies the skin at the back of the thigh. First, the femoral nerve has both sensory and motor branches. The sensory nerves are three main nerves coming out of the femoral nerve. We have the intermediate cutaneous nerve of the thigh, the medial cutaneous nerve of the thigh, and the saphenous nerve. They will supply the area of the skin in the front of the thigh, the leg, and part of the foot, as you can see here in this diagram. The motor branches of the femoral nerve will supply the muscles at the anterior compartment, namely the sartorius and the quadriceps muscles, and also the iliacus. The second nerve that I'm going to talk about now is the obturator nerve. It has also sensory and motor branches. The sensory area that will supply is only that small area at the medial side of the thigh, and its motor branches to the adductor muscles at the medial compartment of the thigh. Also from the lumbar plexus we have the lateral cutaneous nerve of the thigh, which pierces the deep fascia and supplies the skin on the lateral side of the thigh. The other nerve is the genitofemoral. It splits into genital branch and femoral branch. They supply the skin of the scrotum or labia majora and the small anterior part of the thigh here. It also has a motor branch to the cremastric muscle. The sciatic nerve is the largest nerve in our body, and I already covered it in a previous video about the back of the thigh. It supplies the hamstring muscles and splits into two terminal divisions, the common peroneal nerve and the tibial nerve. The common peroneal nerve has sensory branches to the anterior and lateral parts of the leg and also to the dorsum of the foot, and motor branches to the anterior and lateral compartment muscles. While the other division, which is the tibial nerve, it passes at the posterior compartment. It gives sensory branches to the posterior part of the leg and sole of the foot, and motor branches to the posterior compartment muscles and the foot or sole muscles. At the medial side of the ankle joint, it splits into two terminal branches, medial and lateral plantar branches. As we can see here, the medial plantar branch is the larger one. It supplies the medial 2/3 of the skin of the sole of the foot and also the skin of the medial 3½ toes, while the lateral plantar will supply the remaining part, the lateral third of the plantar surface of the foot, and also the lateral 1½ toes. And for their muscular branches, they supply the muscles of the sole of the foot. The lateral plantar supplies almost all the sole muscles except 4 muscles supplied by the medial plantar nerve, and I am gonna cover them in details in the coming video about the anatomy of the foot. This is the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share. And don't forget to hit the notification bell so you know if I upload another video.